My name's Brandon. I'm 35 years old. I work as a clinical pharmacist in oncology. I'm married almost for 4 years now. I have one son with another one on the way. When Dr. Verma first brought up the potential of this device being FDA approved, the non-invasiveness of it, the ease of use, obviously was very appealing to me. And then he went over some of the preliminary data and some of the response rates and everything, and that I kind of fit the patients that it was studied in. So the possibility of being able to, work on me in a non-invasive nature was extremely appealing. I was diagnosed with sleep apnea, about a month before my son was born. As per usual, I was put on CPAP, so continuous positive airway pressure. Dr. Verma and I tried many different tactics to optimize therapy, but I was not able to tolerate it very well. I would consistently pull it off at night and then, use it for very short amounts of time, and just, would wake up, not be able to go back to sleep. So I didn't see much benefit from it, just because the very invasive nature of it, and I'm a very picky sleeper. So anything out of the ordinary for me, really interrupts my sleep. So that didn't go very well. I was using it daily for 6 weeks as was studied and recommended. I kind of integrated it into my nightly routine. So an hour and a half before I went to bed, I would do some kind of wind down activity, either reading, watching TV, or, as we all do, kind of flip through our phones a little bit. So I would pop in the device, get that started, and I was still able to be productive and do different things and kind of have that going along the way. So it didn't really interrupt my daily routine. I just kind of incorporated into it. I have no side effects outside of the actual active treatment. When I have the device in, increased salivation, would be really the only thing I could really say I had a side effect. It took me a little bit to get used to the electrical stimulation, but once you got used to that sensation, sometimes a 20-minute session would feel like 5 minutes. Very early on, actually, I was really apprehensive it kind of seemed too good to be true a little bit. Like a week to 2 weeks, I felt more energetic. I was waking up, clear-minded, and it, didn't take me half an hour to kind of, snap out of this little fog that I was in. Early in the morning, I would feel like I'd had more energy, and then typically in the early afternoon, around that 1 p.m., 2 p.m. period, I would have a crash, really severe energy crash, and I saw that I was able to, proceed throughout my workday or throughout the weekends, with a good amount of energy. So I was able to, be more productive and be a more, active participant in my home life. I would just, like to, point out, it's a great device. When I was diagnosed with sleep apnea, it came as a shock to me. I was 35 years old. I did not have a lot of medical conditions. I was not overweight, as you kind of think about with patients with sleep apnea. So it was a shock, but kind of a relief at the same time that I got it diagnosed, because then Dr. Verma and I could start tackling it and treat it. Some patients with mild sleep apnea, such as myself, this device was really a game changer. And really, I know it's cliche, but it did give me my life back.